questions. I am really grateful for the opportunity to hear from so many involved and experienced in caring for a loved one, either as they age or struggle with Alzheimer's, other forms of dementia or disability. Um, these are um, sort of hidden treasures in our country. Family caregivers in aggregate give, if they were compensated, the equivalent of about $470 billion a year in care. That's equivalent of the Medicaid budget in this country. I think our family heroes who provide care for loved ones ought to be recognized, supported, provided with resources like training, and we recognize that it takes a toll. Physical health, mental health, financial health. And so I am really proud to have worked for a number of years now on a bipartisan bill called the Raise Family Caregivers Act. My partner in the Senate was Susan Collins, a Republican of Maine. Both of us have personal experiences with family caregiving, and that informed as well as provided passion for getting this through. President Trump signed it into law just a few weeks ago, and now we're going to be paying a lot of attention to its effective implementation to create a national strategy and plan that will better recognize and support caregivers. Do you have any questions?
My first question, Senator Baldwin, when you do a roundtable discussion like this, you get some feedback, obviously. What happens from here on out with the feedback that you received today?
Well, great, because this bill just passed and we are going to see it implemented over the next months, including putting together a panel that will have caregivers on it, among other experts and professionals, to advise our federal government on a national plan and strategy around family caregivers. These sort of these stories and this input provides direction for what this panel should consider. Including family caregivers in the health chain that's taking care of someone. They should not be a second thought when doctors or nurses or social workers are calling the person who's dealing with an illness. They should be part of the team. Asking who else can help in their role, so that they're not doing it alone, isolated. Recognizing that in some cases, caring for a loved one, a spouse with dementia, is a 24/7 responsibility. You lose sleep, you lose health, you lose access to people who are your support system. And these are major issues, and it needs to be taken seriously. And we can't put it on a second tier because these loved ones are not compensated.
What's the biggest benefit caregivers will see from this bill? I know there's several, but just give us some of the highlights.
I think I think one of the key ones is combating the sense of isolation, that I'm in this all alone and I don't know where to turn, and I don't know enough about, I have no training as a family caregiver. Each of those are actually fairly simple to address. A phone number of a buddy who you can call who's gone through it before or whatever. If you have access to internet, and not everyone in Wisconsin does, but if you do, the ability to look at online resources on your own time, which might be 3 a.m. when your spouse is able to get a few hours of sleep, and you know that you have a chance to have a moment yourself. So financial counseling. If you feel you have to pare back in hours, that changes your budget. If you're increasingly trying to purchase things for your loved one, like groceries, to make sure that they don't forget to feed themselves, or they can't get out to a grocery store, there may be resources that you can reach out to that leave a less of a impact on your own budget. All of those things, there's so many things, and some of them have fairly straightforward answers. Others are more complicated.
Governor, in regards to gun control, there's a representative who wants to propose a bill in regards to teachers carrying concealed weapons in private schools. What is your stance on that?
So, in my role at the national level, let me start by just recognizing the tragedy in Florida. I have reported back to work in Washington so many times after Orlando, after Las Vegas, after this tragedy in Florida, and we've resolved that we want to do everything we can to make this the last time, to make this rarer, to make common sense safety steps. I do have a sense that that there is that this is somehow different. I have been among the many who have listened to the voices of those teens, those students, who have basically looked to the grown-ups in their lives and say, it's your responsibility to do more to keep us safe. School should be safe. I've seen a little bit of movement in the president, in others saying, maybe we can get rid of bump stocks that make a semi-automatic weapon into an automatic weapon. Maybe we can finally have comprehensive universal background checks where there's no loopholes, and where we can hopefully earlier detect warning signs. I think the NRA is too powerful, and I think they don't reflect their own members. I'm a gun owner. Every gun owner I know is open to the idea of comprehensive background checks. And I think these children may lead the way.
Senator, if I could just piggyback off that question. You mentioned the bump stocks and President Trump mentioning with the Department of Justice to have a ban on those types of devices.
Yes.
A comment on that? What are your thoughts?
Well, it was actually after the Las Vegas massacre. There was a moment that I thought Congress might actually take up a bill to ban bump stocks. It was one of the first times that I ever heard the NRA support an effort in response to a massacre to take a legislative or regulatory step. Sadly, as we've seen too many times, attention switched to a new issue, and we didn't see legislative action. I'd still like to see legislative action. I signed on to the measure that would have banned bump stocks. But this action is certainly hopeful also. And I'd rather see that happen than nothing at all. But I would like to see the Congress of the United States act like grown-ups and protect these children.
Thank you.
All right. Thank you.